It was? Okay.
Operator error, don't worry.
We now come to order. I recognize myself for 5 minutes for the purposes of an opening statement. In 2004, EPA initiated a review of the lead and copper rule following the lead crisis in Washington, D.C. 16 years later, we are still waiting for EPA to finalize its long-term revision. The intention at that time was to take action to prevent the next crisis. Since then, we have witnessed one water crisis after another, upturning the lives of millions in Flint, in Newark, in Pittsburgh, and other communities which have had to suffer, at least partially, due to an unprotective standard. Last year, EPA proposed its long-awaited revision for the lead and copper rule. The deadline for public comment is tomorrow. I expect we will hear today that the proposal still needs work. And in my opinion, it falls far short of the meaningful protective action necessary to get lead out of our drinking water systems. Today's panel includes witnesses representing health experts, environmental advocates, state regulators, local governments, and utilities. I appreciate everyone's perspective and hope we can find some common ground around which a goal can be developed. It was common that we share in those efforts and ensuring that Americans have safe drinking water. The lead and copper rule was first promulgated in 1991, so we have known for decades that there is no safe level of lead for children. We also know that the impaired brain development these children experience from lead exposure will follow them the rest of their lives. Unlike other contaminants, lead enters into drinking water from within the system. It can be found in millions of service lines and fixtures within homes. Action to get the lead out of our water systems starts with identifying existing service lines and making that information publicly available. I support EPA's proposal to require inventories of service lines, but identifying these lines must be followed with full replacement, removing lead service lines and prohibiting unsafe partial replacements. Many of the communities currently responding to lead contaminations are doing this at no cost to residents. Unfortunately, the proposed lead and copper rule revision does not require proactive service line replacement. It also fails to establish a health-based household lead action level or even reduce the current action level of 15 parts per billion. The proposal does include a new trigger level for utilities to begin to plan for future action at 10 parts per billion. But we already have challenges with risk communication and lead contaminations. And in practice, this new level adds complexity to an already complicated rule without directly improving public health outcomes. I know replacing all lead service lines will not be easy or cheap. That is why I strongly support additional federal funding to ensure that state and local governments, schools, daycares, and water utilities have the resources necessary to map and replace water infrastructure containing lead as quickly as possible. Today, we will also hear about other aspects of the proposal, including treatment requirements, sampling procedures, public notification, and monitoring at schools and child care facilities. Ultimately, the revision as proposed will not require the action needed to get lead out of our drinking water systems. This EPA proposal has further demonstrated the major deficiencies of the Safe Drinking Water Act, which have prevented EPA from setting enforceable standards that are truly protective of public health. The past 24 years of CIDWA, including recent considerations of PFAS, have made it clear that the regulatory framework for standard setting has left Americans dangerously exposed. I look forward to today's discussion on EPA's proposal and hope that we can continue to explore the reforms necessary to ensure the Safe Drinking Water Act is able to guarantee the safe water that our constituents expect, our constituents require, and our constituents deserve. With that, I'll now recognize Mr. Shimkus, our ranking member of the Subcommittee on Environment and Climate Change, for 5 minutes for his opening statement, please.
Thank you, Mr. Chairman. Mr. Chairman, lead is a potent neurotoxin, exposure to which is known to cause serious educational deficits in children. Our country has made significant strides in reducing harmful exposure to lead by removing it from gasoline and paint. Even still, preventing lead from entering drinking water remains a serious issue, and it deserves this committee's attention. Over the last 15 years, breakdowns in oversights, engineering, enforcement, leadership have caused and highlighted some of the more troubling incidents of increased levels of lead in drinking water. In Washington, D.C., in Flint, Michigan, and in Newark, New Jersey, and every community we represent, our constituents should be drinking safe water from their taps. What is troubling to me today is not that we are addressing this subject, but that we are not giving it the serious attention it deserves. Almost 3 months ago, the Environmental Protection Agency issued its first major revision of the lead and copper rule since 1991. This is obviously long overdue, and I'm glad they at least released this in November. This updated rule has been greatly anticipated by the regulated stakeholders and the general public, and since its release, many have expressed strong feelings about its contents and whether it does too much or not enough. Meaningful oversight is an imperative, but that's not what is happening here today. Why? To the best of my knowledge, the decision to have this hearing was made just over 7 days ago, an amount of time that barely meets the requirements of the committee's rules. This might be less of a problem if this were an easy subject which we all agreed upon, but it's not. It's a highly technical, emotionally charged matter that demands time and attention to be done right. Moreover, it seems we're continuing a pattern of complaining about the agency without affording them the opportunity to explain themselves. The EPA has been clear with us in the past that a week's notice isn't sufficient to provide members the detailed context and answers that we expect. I understand the agency offered to provide us a witness on other dates if the committee wanted them. It appears they did not. I am not the only one who thinks the EPA was unwanted here today. The agency itself has publicly asserted some of these same points in a press statement, which they released this morning, and which I'd ask unanimous consent to place into the record, Mr. Chairman.
Review it.
Had EPA been here, I would want to ask where the agency sees pipe replacements versus optimized corrosion control, considering from 1991 to 2001, the number of large systems exceeding the action level for lead dropped by 90%. I would ask how the 2012 amendments tightening the amount of copper and brass in fixtures was impacting drinking water levels. I would ask what time, effort, and resources EPA planned in undertaking to assist water systems, especially in rural and low-income areas, to comply with the proposed rule, as well as make information available for managing the rule. And I would ask how the agency expects communities to pay for new mandates. The reality is this rule will increase costs, and the Drinking Water State Revolving Fund will not be able to meet all these needs. Moreover, the fund should not be viewed as a way to federally subsidize rates, and I want to ask about the agency's thinking on this question too. These are just my questions, but they are worthy of a live public discussion that addresses these and other concerns raised in the testimony. For our witnesses that are here today, thank you for being with us. Most of you are not local and had to rearrange your schedules to make hotel and travel written testimony, finish your comments to the agency on this rule, and travel here in a few days' time. We appreciate your sacrifice under the expedited time frame and look forward to what you have to tell us. Before I yield back my time, I want to ask unanimous consent to have the following letter inserted in the hearing record from the Honorable Dominic Longobardi, Mayor of Floral Park, New York, President of the Hempstead, New York Board of Directors, and members of the American Public Works Association Board of Directors. We believe his views are important and should be included in the hearing record, even though we were refused an additional witness. With that, Mr. Chairman, I yield back my time.
Okay, we'll submit that without objection.
Thank you.
The release from the EPA seems to have some inaccuracies in it, so perhaps we should have staff go through it and,
Okay, that'll be fine.
okay?
So we'll just hold that off until further review.
Right. So the gentleman yields back. The chair now recognizes Representative Pallone, Chair of the full committee, for 5 minutes for his opening statement, please.
Thank you, Mr. Chairman. Today's hearing focuses on a widespread and pressing public health crisis, lead contamination in drinking water. Safe drinking water is a fundamental right and duty of our federal government. Every American should be able to turn on their tap confident that the water coming out is safe. And this should be true for all communities, and it must be safe for pregnant women, infants, children, and the elderly. But we're falling short and failing communities like Washington, D.C., Flint, Michigan, and Newark, my home state of New Jersey. The Environmental Protection Agency has an important opportunity to strengthen our protections against lead by revising the lead and copper rule, but unfortunately the Trump EPA's recent proposal squanders that opportunity. Lead is a known toxin, and Congress banned lead pipes in '86, but those pipes remain in the ground, leaching lead into the drinking water that comes into our homes and schools. Since 1991, EPA has set the maximum contaminant level goal for lead in drinking water at 0, but nearly 30 years later, EPA is still saying we can't achieve that goal or even get close to it. To make matters worse, the Trump EPA's proposed rule would not even set us on the path to achieving the goal of lead-free water because it doesn't require aggressive replacement of lead service lines. And the proposal also falls short of providing the certainty and clarity states and localities need in implementing the lead and copper rule. It ignores the lessons of Flint, so it will fail to prevent the next Flint. It also doesn't properly reflect some of the lessons from the drinking water issue in Newark, New Jersey, where aggressive lead pipeline replacement appears to be working. Any final rule that fails to aggressively replace lead service lines will fail to solve the problem of lead in drinking water, and those shortcomings should be addressed as EPA works to finalize this important rule. Ultimately, if EPA were to finalize this proposal, there's a real possibility that 30 years from now we could be no closer to ensuring lead-free water for the American people, and we can't allow that to happen. The inactivity over the last 30 years certainly highlights the weaknesses in the lead and copper rule. The fact is that the Safe Drinking Water Act instructs EPA to set drinking water standards based on cost-benefit analysis, not public health. And this is a fundamental flaw in the statute that leaves vulnerable populations and disproportionately exposed communities unprotected. This hearing is the beginning of work in this subcommittee to explore how the Safe Drinking Water Act should be reformed. I thank Chairman Tonko for undertaking this work. The Safe Drinking Water Act should absolutely ensure that drinking water is safe, and that means health protective, not defined by cost-benefit analysis. Chairman Tonko and I have worked together repeatedly over the years to provide more funding for drinking water infrastructure. That funding not only helps cities and towns modernize their infrastructure and protect public health, but it also creates jobs. We'll continue to work to provide the resources water utilities need, the resources that those utilities need to address lead and other threats to public health. The cost of replacing lead service lines should be addressed through infrastructure funding and financing. It should not dictate how safe our water can be. Now, the science is clear. There's no safe level of lead exposure. The time for action is overdue. EPA has to strengthen this proposal to protect public health, including the health of vulnerable populations, and we in Congress should strengthen the Safe Drinking Water Act to do the same. So I just want to welcome Kim Gotti from Clean Water Action of New Jersey for joining us today. I look forward to hearing from Kim and from all our witnesses about ways we can strengthen the Safe Drinking Water Act for the future to better protect the American people. And I now yield the rest of my time to Congresswoman Dingell from Michigan.
Thank you, Chairman Pallone, for yielding. I would like to briefly recognize an important witness here today, Dr. Mona Hanna-Attisha from the great state of Michigan, who has done some truly amazing work to help bring critical attention to the dangerous levels of lead in Flint, Michigan's drinking water. And she's become a national champion. Dr. Mona, as the kids call her, thank you for being here. We're all grateful to you for all the work that you've done during the Flint water crisis and all the good that you continue to do as a pediatrician, professor, and public health advocate. There is much that the committee can learn from her today, and it's an honor to have you here. This is actually a very true story. I met Dr. Mona early on, like before any of you had heard about Flint water, and it was the first sick child that I met. And you all can picture me doing this. I was going to take the child in my arms, put him in the car, and take him to the best hospital I could in the country. And she said, okay, Debbie, take a deep breath. It's systematic. There are a lot more kids like this. And she's taught me much ever since that first day I met her. Welcome, and I welcome all the witnesses for being here today. I yield back. It is a true story.
The gentleman yields back. The chair now recognizes Representative Walden, ranking member of the full committee for 5 minutes for his
Morning,
opening
Mr.
statement,
Chairman.
please. Good morning.
And I'll say at the top of this, we have another subcommittee meeting concurrent with this one, so some of us will be going back and forth. But we all believe the issue of lead exposure in drinking water is of great concern to the safety of our citizens, safety of our children, to our communities, and to our overall health and well-being. The question is, how do we tackle this issue in a way that makes the most sense for public health in a broad sense, in a constitutionally permissible manner, and that best leverages finite public and private resources on this task? No matter how simple people want to make this issue, from engineering to policy choices, the lead and copper rule and its proposed revisions is one of the most technical and challenging drinking water rules that EPA has. It's really hard work. Lead is typically not present in drinking water sources, nor is it removed at the treatment plant. Moreover, as raised in testimony of the witnesses from the Association of Metropolitan Water Agencies, even if every lead service line in the country were replaced, lead-tainted home plumbing fixtures and piping would continue to present lead exposure issues, my understanding. So getting EPA to agreement in 1991 on the existing lead and copper rule was no small feat, and the fact that its revisions have taken 3 decades to formally propose is both frustrating but not surprising. While they are not here to accept congratulations, Administrator Wheeler and the staff in the EPA's Office of Groundwater and Drinking Water deserve great credit for finally getting a proposal out the door when many had given up on its prospects altogether. As we all know, though, the proposed rule is still very early in the process. Tomorrow, the public comment period closes, and the EPA will be busy digesting and assembling responses to the many issues the public is raising on this rule, which I expect today to be just a brief preview. While I wish we had this oversight hearing at a time when the EPA and a broader set of witnesses could be heard, it's important that we learn these issues on the front end to understand their impacts when decided by the EPA. So I'm especially interested in learning more from Mr. Estes Giassi. I get close on that? Oh, good. Well, don't expect me to do it twice. Get it right. And other municipal officials about the impact the mandates this proposed rule will place on drinking water systems, particularly unfunded mandates, because that's something we have to be aware of. The Drinking Water State Revolving Fund program in the Safe Drinking Water Act owes its existence entirely to a congressional desire to address unfunded mandates posed by federal regulations, not to subsidize rates or chase other collateral goals. I also want to understand from these same folks whether this rule strikes the correct balance between addressing lead pipes, their treatment or replacement, in a cost-effective way for citizens and local governments. So we must also be careful not to avoidably have federal law and state and local requirements conflict with each other and make simultaneous compliance impossible. We've all seen that happen before in different areas. In addition, because continued disturbances that rattle pipes in turn shakes new lead into the system, I also want to better appreciate what economic and practical impact this rule might have on local planning related to other emergency services like fire safety, sewage, and telecommunications. And finally, I'm interested in learning from Commissioner Bobbitt as a rural elected official. I think we must look at the cost of this rule to taxpayers, states, communities, and the federal government. Every finite dollar we spend here is $1 less we can spend on other public health priorities, and we have a lot of those. So, Mr. Chairman, thanks again for having this panel, and I want to welcome our witnesses, and some of you I know are making return appearances, and we appreciate that. We're fortunate to have the level of expertise that many of you bring to this subject, and I look forward to the question and answer period to get behind your written statement. So thanks again for your participation. We share a goal here, and hopefully we'll get a good outcome. And with that, I yield back, and I have to go to the other sub.
The gentleman yields back. We thank him, and the chair would like to remind members that pursuant to committee rules, all members' written opening statements shall be made part of the record. I agree with Representative Walden's assessment that this is an expert panel, that we're very much helped by your presence here today. So thank you for joining in this discussion, which will lead us to, I think, strong advocacy. I now will introduce the witnesses for today's hearing. We begin with Dr. Mona Hanna-Attisha, Director of Pediatric Public Health Initiative with C.S. Mott Endowed Professor of Public Health, Division of Public Health, Associate Professor of the Department of Pediatrics and Human Development at Michigan State University with the College of Human Medicine. So quite the credentials. Next, we have Kim Gowdy, who is with the environmental justice efforts. She's an organizer with Clean Water Action of New Jersey. She's joined us in the past, so welcome on the return. Ms. Angela Licata, I believe, is that pronunciation correct? New York City Department of Environmental Protection, and she's appearing on behalf of the Association of Metropolitan Water Agencies. Next, we have Ms. Kathy Tucker Vogel, Public Water Supply Section Chief with the Kansas Department of Health and Environment, and she's appearing on behalf of the Association of State Drinking Water Administrators. Mr. Steve Estes Marchiasi, Director of Planning and Sustainability at Massachusetts Water Resources Authority, and he's appearing on behalf of the American Water Works Association. And we then have the Honorable Cindy Bobbitt, Commissioner of Grant County, Oklahoma, and she's appearing on behalf of the National Association of Counties. And finally, Ms. May Wu, Senior Director of Health and Food, Senior Attorney, Healthy People and Thriving Communities Program with the Natural Resources Defense Council. Again, to each and every one of you, thank you for taking the time and for informing us. Before we begin, I would like to explain the lighting system. In front of you are a series of lights. The light will initially be green. The light will turn yellow when you have 1 minute remaining. Please begin to wrap up your testimony at that point. The light will turn red when your time has expired. At this time, I recognize Dr. Hannah Atisha for 5 minutes to provide her opening statement, please.
Good morning.
Good morning.
I would like to begin by thanking Chairman Paul Tonko, Ranking Member John Shimkus, and all the distinguished members of the subcommittee for the opportunity to present today. A special thank you to Michigan Congresswoman Debbie Dingell for all of her leadership and support of Flint kids during the crisis and since. Like all of you, I also took an oath. As a pediatrician, I literally put my hand up and dedicated my career to serve and to protect the children entrusted in my care. Much of that work centers around the child in front of me to make sure that they're healthy today, but more importantly, my work as a pediatrician is nestled in protecting and promoting the promise of our children. Yet in Flint, there was something in our water, something that you couldn't see or taste or smell, that was threatening the tomorrows of all of our children. In a breakdown of democracy and driven by austerity, our drinking water source was changed without proper corrosion control treatment. The corrosive water leached lead from our infrastructure into our water in the hundreds and thousands of parts per billion. It has been said that pediatricians are the ultimate witnesses to failed social policies. It is in our exam rooms where we see the everyday consequences of policy decisions like Medicaid cuts and inaction on gun violence and lax public health protections. Our children disproportionately bear the burden of these consequences, both in their bodies and in their blunted potentials. And as a pediatrician in Flint, I can attest that once again, our children were the victims of a failed policy. Specifically, the lead and copper rule that provided the vehicle of loopholes, minimal oversight, confusion, and non-health-based standards that helped create and perpetuate our crisis. I wish there was a magic pill that could take away what happened, but when it comes to lead, the treatment is prevention. Lead is an irreversible neurotoxin with lifelong, multi-system, multi-generational impacts. There is no safe level. Children should never be exposed to lead. What we should be practicing is what we call in public health primary prevention. And that is why in Flint, after our citywide exposure, our only option has been to move forward, to create a sanctuary where children can recover and thrive. Critical to our recovery has been the congressionally supported Flint Lead Exposure Registry. With funding set to expire next year, absent congressional action, the Flint Registry has been an essential resource for identifying individuals exposed to our crisis, connecting them to public health promoting resources, and sharing best practices with similarly impacted communities. Flint's crisis is an extreme case, but not the first, not the last, and not the worst. A positive ripple effect of our crisis has been the growing awakening across our country that our drinking water regulations never intended for us to consume lead-free water. A troubling number of our cities across the country are now recognizing and struggling with elevated lead in their drinking water. On behalf of children everywhere, we need a stronger lead and copper rule that catches policy up with science, rights historic wrongs, and prioritizes public health over minimal compliance. Unfortunately, the proposed revisions are a missed opportunity and fail to rebuild trust in our nation's drinking water. With further details in my written testimony, I recommend that the EPA make the following improvements. 1, lower the action level and remove the trigger level. 2, mandate removal of all lead pipes and ban partial line replacements. 3, improve sampling to better detect lead in water, especially the contribution from service lines. And 4, improve communication, public health, and transparency. Michigan has decided that we can do better, and we revised our state lead and copper rule in 2018. It exceeds national standards. It is now implemented, and Michigan's lead and copper rule now better locates service lines through mandatory inventory, improves education and transparency, mandates the replacement of lead lines, and more optimally samples for lead, and will eventually lower the action level. Our nation can learn from Michigan and do better. In conclusion, in 1969, a scientist warned that the problem of lead is so well defined, so neatly packaged, with both causes and cures known, that if we don't eliminate this social crime, our society deserves all the disasters that have been forecast for it. We've come a long way, but we have more to go. We have not eliminated this social crime, and as a pediatrician, I continue to diagnose in the bodies of our children the consequences of our collective inaction and paralysis. Thank you for the opportunity to testify, and I look forward to your questions.
Thank you, Doctor. And now we recognize Ms. Gaddy. You're recognized for 5 minutes, please, and again, welcome.
Good morning, Chairman Tonka and Ranking Member Shimkus and all members present, as well as Congressman Pallone from my home state of New Jersey. My name is Kim Gaddy, and I am the Environmental Justice Organizer for Clean Water Action of New Jersey. Clean Water Action is a national organization working in 14 states on environmental and health issues with a focus on drinking water and water pollution. Thank you for the opportunity to address the subcommittee today. Although I live in Newark, I'm also here to lift up the voices of residents in environmental justice communities, to speak about the needs of all communities in New Jersey, and to comment on how this Environmental Protection Agency can improve its proposal to revise the Safe Drinking Water Act lead and copper rule. Our experience with elevated lead levels in Newark points to the need for clear federal requirements for water systems and state permanency agency. We also sorely need increased federal investment in water infrastructure, in EPA and state implementation and enforcement, and in promoting improved managerial operations and communications capacity for water systems. In Newark, we experienced the difficulty of communicating health risk and technical information. At a time when residents needed the clearest possible information, some felt that city officials were not being transparent. The role of our state agency in overseeing our water systems compliance with regulations was not obvious to residents, nor was the role of the EPA regional office. Rules and procedures for water systems need to be straightforward, and the state's responsibilities need to be well defined as well. Newark has taken significant steps to reduce the risk of lead at the tap, including partnering with the state to fully replace, at no cost to the homeowners, 18,000 lead service lines in 3 years. New treatment has been installed and is expected to reduce lead levels by the end of the year. Filters and replacement cartridges have been made available to impacted residents, as well as free water testing. We are relieved to see progress, but we think this crisis could have been avoided, and if we can prevent similar problems in other New Jersey communities and around the country, we must act now. Revisions to the lead and copper rule are not the only solution, but they can help to prevent communities from experiencing what we have gone through in Newark. While water chemistry and treatment play a role in whether lead leaches from pipes and fixtures, removing sources of lead in contact with water is the best way to reduce lead at the tap. Lead service lines are the largest source of lead in tap water. EPA has missed an opportunity to address this source of lead by requiring full lead service line replacement at all regulated water systems. This is an ambitious undertaking, but momentum toward full replacement has never been greater. Water systems across the country are prioritizing replacement, and some have committed to fully replacing all lead service line, including Newark. States are taking action to support this activity, and New Jersey as well. EPA's own proposal signals throughout the full lead service line replacement is a desirable goal that is achievable. EPA proposes that water systems submit lead service line replacement plans that include a wide range of details that will be involved in setting up a replacement program. While EPA's proposal envisions these plans being used in the event of elevated lead levels, the requirement suggests that EPA has determined that all systems with lead service lines are able to develop such plans. Many other aspects of the proposal indicate that EPA knows that full lead service line replacement is the most obvious way. Clean Water Action is calling on EPA to require full lead service line replacement at all water systems with a baseline goal of 10 years. Had such a requirement been in place, perhaps Newark could have been spared the crisis that erupted in the wake of lead action level exceedances. We need to start now to get the lead out of contact with drinking water to prevent elevated lead levels and similar crises in other communities in New Jersey and across the country. As we learned in Newark, full replacement programs are impeded when customers are required to pay for replacement of the portion of the line on the customer side. It is more equitable and efficient for water systems to cover this cost. When Newark lead service line replacement program started, the homeowner was originally going to contribute $1,000 toward the cost of the full replacement, while less than the cost than homes owners. In Newark, over 75% of residents are renters who did not receive water bills or information about replacement programs and other issues. I'm a Newark renter who experienced this firsthand. We know that there is no safe level of lead. We know that health impacts of lead are on particular concern of children under 6. That's why we are urging EPA to strengthen its proposal and urging Congress to support a vision of modernized drinking water systems by making bold investments now. Thank you.
Thank you very much. Next, we'll move to Ms. Licata, please, for 5 minutes with your opening statement. Thank you.
Chairman Tonko, Ranking Member Shimkus, and members of the subcommittee. The Association of Metropolitan Water Agencies, or AMWA, appreciates the opportunity to offer our thoughts today on EPA's proposed revisions to the lead and copper rule. I am Angela Licata, Deputy Commissioner of the New York City Department of Environmental Protection, or DEP. Each day, DEP delivers more than 1 billion gallons of fresh, clean water to the taps of millions of customers throughout New York State. That is 9 million people. I also serve as Vice President of AMWA's Board of Directors. AMWA is an organization representing the nation's largest publicly owned drinking water systems. AMWA's members collectively serve more than 155 million Americans with quality drinking water, and the association has developed detailed comments in response to EPA's proposed revisions to the lead and copper rule. These comments, which will be formally submitted to EPA this week, are the basis of the association's testimony today. And please note that I address you as a representative of the AMWA Board of Directors, and that tomorrow New York City will submit its own written comments to EPA. AMWA's comments outline a number of places where we agree with EPA's approach, but identify numerous areas where we believe there is room for improvement. Addressing lead in drinking water is a particularly vexing challenge because, unlike most other contaminants, lead is typically not present in drinking water sources. Instead, lead may be introduced into the drinking water of communities when the water reacts with lead in buried service lines and premise plumbing in homes. Making things even more complicated is the fact that homeowners are responsible for their interior plumbing, and ownership of service lines are typically divided between the public water system and the private homeowner. There is no easy solution that can quickly eliminate this problem. Even getting rid of every lead service line in the nation would not eliminate exposure to lead, as lead solder and plumbing fixtures would remain in millions of homes throughout the country. In terms of the proposed lead and copper rule revisions, AMWA believes the most effective regulations must be achievable, practical, and enforceable. AMWA appreciates that the proposal avoids setting mandates such as a deadline for the replacement of all service lines nationwide. While removing all lead service lines is a worthy aspiration and should be a goal, in reality doing so would take decades, cost billions of dollars, and require the cooperation of millions of individual homeowners. It would prevent water systems from allocating their limited budgets to other initiatives that may deliver greater public health benefits, such as other emerging contaminants, such as PFAS, and dealing with aging infrastructure and resilience to climate change. We also support aspects of the rule that require water systems to complete an inventory that specifies the composition of service lines and that require large systems to post these inventories online. Armed with this information, individual homeowners will be empowered to direct their water system to replace the publicly owned portion of the lead service line when the homeowner simultaneously replaces their privately owned lead line. AMWA has a number of suggestions to make this process as seamless as possible, but we generally agree with the intent. AMWA also agrees with steps the proposal takes to discourage partial lead service line replacements, such as making them ineligible to count towards mandated replacement rates. AMWA agrees that a total ban on partial replacements would be ill-advised. For example, emergency water replacement work may require a water system to replace the publicly owned portion of the household's lead service line. Because customer consent to replace the private portion of the lead service line cannot always be quickly obtained, it would be impractical to completely ban partial replacements in these circumstances. Other parts of the proposed rule require improvement, and we harbor deep concerns requiring a water system to notify all customers within 24 hours of any 90th percentile lead action level exceedance. This goes far beyond the mandate set by Congress in the 2016 WIN Act, which only requires this urgent notification if the exceedance has the potential for serious adverse human health effects as a result of short-term exposure. We believe an urgent notification in the absence of such health risks could unnecessarily alarm the public. We also have strong concerns with aspects of the proposed rule that would require water systems to obtain and distribute high quantities of pitchers that may not readily be available, prompt adjustments to a water system's corrosion control based on only a small number of samples showing elevated lead levels, and task water systems with compelling school and child care centers to give water quality testing in their facilities. In closing, AMWA supports achievable, practical, and enforceable action to reduce public exposure to lead in drinking water. This concludes my statement, and I would be happy to answer any questions you may have.
Thank you very much, Ms. Licata. And next, we'll go to Ms. Tucker Vogel. You're recognized for your opening statement of 5 minutes, please.
Good morning, Chairman. Good morning, Chairman Tonko, Ranking Member Shimkus, and members of the subcommittee. Thank you for inviting me to speak today. I'm the president-elect of the Association of State Drinking Water Administrators, whose members include the 50 state drinking water programs, 5 territorial programs, the District of Columbia, and the Navajo Nation. ASDWA members have primary oversight responsibility for implementing the Safe Drinking Water Act and provide technical assistance, support, and oversight of drinking water systems, which is critical to ensuring safe drinking water. I'm also chief of the Public Water Supply section within the Kansas Department of Health and Environment. Today, I will discuss ASDWA's perspective on EPA's proposed lead and copper rule revisions and how to strengthen the rule to more effectively address lead in drinking water and protect public health. I would also like to note that this testimony reflects recommendations of ASDWA and may not necessarily reflect the position of the Kansas Department of Health and Environment. Lead in drinking water has long been a concern for communities across the nation. Although considerable progress has been made in reducing lead in water since implementation of the 1991 lead and copper rule, large-scale crises in Flint, Michigan, and Washington, D.C. stand as proof that lead continues to be a public health concern. States, water systems, and the public need national leadership to continue making progress in reducing exposure to lead through drinking water. ASDWA's key issues on the LCRR include the following. First, it's time to get the lead out. Replacing all lead service lines is the long-term solution for reducing exposure to lead in drinking water. The first step towards removal is an inventory of all service lines. ASDWA supports regulatory requirements for water utilities to develop a lead service line inventory and replacement plan, or demonstrate the absence of lead in their distribution systems. EPA must clarify its lead service line definition for galvanized lines, goosenecks, and pigtails, and should include unknown service lines as lead. ASWA also recommends strengthening the rule to require a minimum of 10% lead service line replacement over a 3-year period for any system with lead service lines and a 20% replacement over 3 years for systems that exceed the lead action level. Second, continue to reduce exposure from lead in drinking water. To reduce lead exposure, ASWA recommends improved sampling, corrosion control treatment, and water quality parameter monitoring to ensure appropriate water quality is maintained, particularly when water sourcement or treatment processes are changed. ASWA recommends sample site assessments proposed as find and fix be included in the final rule to ensure there is appropriate corrosion control throughout the distribution system. In addition, ASWA recommends systems have an upon request rather than a mandatory lead testing program for schools and child care facilities. Third, work to increase transparency and clarify public notification. Public access to lead service line inventories will demonstrate transparency and is critical to helping utilities be a trusted source of information. Tier 1 public notification has historically applied to acute maximum contaminant level violations where immediate action is necessary to protect public health. The proposed change in the LCRR for action level exceedance alters the logic for Tier 1 public notification for acute MCL violations. And fourth, additional funding for states, EPA, and water utilities is essential. The significant increase in the complexity of the proposed rule places additional burdens on states. EPA proposed several new program requirements with significant tracking, review, and approval components. Adding to the burden, there is not a data system that exists at the state or federal level that supports implementation of the rule. Without additional funding and a functioning data management system, implementing the LCRR will be impossible for most states. Increased funding for EPA and for states is vital to support the implementation of the LCRR. Finally, funding is needed to assist water systems with lead service line replacements. State revolving fund programs provide loans, but there are competing priorities for the subsidy, including emerging contaminants and aging infrastructure. In conclusion, ASWA thanks the subcommittee for holding this hearing on these important topics and commends EPA for moving forward with the LCRR. ASWA looks forward to continuing dialogue with Congress and our federal agency partners. I'll be happy to take questions at the appropriate time. Thank you.
Thank you, Ms. Ducker-Vogel. Now we'll move to Mr. Estes Smerigasi for 5 minutes for your opening statement, please.
Chairman Tonko, Ranking Member Shimkus, and members of the subcommittee, the American Water Works Association appreciates the opportunity to offer our thoughts on EPA's proposed revisions to lead and copper rule. My name is Steve Estes Smargiassi. I'm Director of Planning and Sustainability for the Massachusetts Water Resource Authority, the regional wholesale water and sewer provider to 3 million people in 61 cities and towns in the Metro Boston region. I've been involved in our region's collaborative efforts on lead for over 25 years, serve on EPA's National Drinking Water Advisory Council's work groups on the lead and copper rule, and chair AWWA's Lead and Copper Technical Advisory Work Group. The AWWA strongly supports full removal of all lead service lines. Indeed, our board of directors voted to endorse the 2015 recommendations made by the National Drinking Water Advisory Council, NDWAC. I'll quote from them. AWWA supports the NDWAC recommendations to reduce lead in drinking water through the complete removal of lead service lines while ensuring optimal corrosion control measures. Support of the NDWAC recommendations underscores the importance of protecting the public from lead exposure through the development of collaborative, community-based approaches to remove all lead service lines in their entirety. Effective lead service line replacement requires solutions that successfully address the often shared ownership of these lines, the associated financial burden, and other barriers and risks, end quote. EPA's proposed revisions are an important step forward. We've offered what we hope are constructive comments on the 90 pages of the Federal Register notice to make the rule clear, implementable in the field, and enforceable. We believe that the proposed rule requirements for immediate development of inventories of all lead service lines, making those inventories publicly available, immediate development of plans for the full removal of all lead service lines, no partial lead service line replacements except under the narrowest of circumstances, and provision of an annual notice to every home with a lead service line will go a long way towards a future where there aren't lead service lines connecting our water mains to our customers' homes. Regulatory mandates, though, are only one part of solving this problem. One obstacle to full lead service line replacement is the cost, particularly the cost of the portion on private property. My agency has tried to remove that obstacle by creating a $100 million fund for our member communities. But the ability of lower-income families to afford even a loan can be an issue. Congress has appointed $45 million for assistance to low-income homeowners. We hope that you will continue to direct substantial funds to this critical need. Another obstacle is creating and sustaining community interest. We all know that a crisis creates short-term momentum, but more efforts needed to keep going until that last service line is removed. In one of our gateway cities, Chelsea, we've been working with our local Clean Water Action organizers to do door-to-door canvassing to encourage residents to participate in that community's replacement efforts. Neighbors speaking the same language become trusted sources of information and assistance in navigating the program. I mention this to stress that every program will be different. A national lead service line removal program is actually 50,000 local programs tailored to local circumstance. Any regulatory approach needs to account for that. A frustration that we all encounter in dealing with lead is the siloing of programs. The Department of Housing and Urban Development has programs to pay for lead paint removal. When they're done, they call the home lead-free, without checking for or allowing for the removal of any lead service line. That cries out for a legislative push towards integration of those efforts. Until recently, our state's lead poisoning prevention program, like most others, didn't test the water or check for lead service lines. My agency is now providing training and lab services to make that happen. Again, these types of structural program problems could be solved nationally with coordinated efforts by HUD, HHS, and Department of Education. A final note on risk communication. Lead's a powerful neurotoxin affecting children's development, and thus it's one of the most sensitive and alarming of the topics that we talk to our customers about. Where and when there is a risk, we need to coordinate with trusted partners in the medical and public health professions to clearly communicate that risk. Rushing that task and failing to do it effectively fails our customers, preventing those who need to take action from doing so and unnecessarily alarming others. I hope that AWWA's written comments and those of my colleagues here on the panel have been helpful to the committee, and I welcome any questions.
Thank you, Mr. Estes Margassi. And we'll now move to Commissioner Bobbitt, please, for 5 minutes with your opening statement, please.
Chairman Tonka, Ranking Member Shimkus, and distinguished members of the subcommittee, thank you for the opportunity to testify on this important issue. My name is Cindy Bobbitt, and I am a county commissioner from Grant County, Oklahoma, and honored to testify on behalf of the National Association of Counties. Today, I'd like to offer the county perspective for your consideration as you assess challenges and opportunities around eliminating lead contamination in our drinking water. First, while our responsibilities vary from state to state, county governments serve as both regulators and regulated entities when it comes to the Clean Water Act and work every day to ensure the health and safety of our residents. We operate jails, hospitals, 911 emergency systems, build roads and bridges, and run elections. But one of the most important things we do is maintain and operate water systems to provide clean drinking water. We often do this through partnerships, especially in rural communities like mine. Grant County has a population of 4,500. We have 11 water systems, and we are responsible to ensure water quality standards and meet the needs of all. This includes protecting our water systems and water quality during disasters and major flooding events when we have them. Counties across the country share our federal partners' concern and are committed to do all we can to eliminate lead contamination in all of America's drinking water. Second, due to limited local resources and mounting regulations, counties are challenged to make long-term budget investments. Regardless of size, Fiscal constraints are the reality for most counties, and we are mandated to provide a growing number of services while operating under greater state and federal restrictions on how we generate revenue. In fact, 45 states limit counties' ability to raise additional revenue. According to the EPA, administering the proposed rule is estimated to cost local water systems between $130 and $270 million annually and up to $8 billion over 30 years. There are between 6 and 10 million lead service lines in our country, and preliminary findings show that the average cost to replace a single line is $4,700. Using these figures, replacing all lead service lines would cost local water systems between $26 and $47 billion, creating enormous unfunded mandate for local governments. Counties support the goal of replacing all lead service lines in the U.S., but it's important that our federal partners recognize the growing number of federal and state requirements on local governments and understand the full picture of county public priorities. Communities like mine with low-income populations are often more at risk of lead exposure due to our older housing infrastructure. These counties are really limited in raising additional revenues. Raising taxes in my county and placing financial burden on our people who have a median income of $28,000 is not an answer to pay for additional federal mandates. So counties are once again faced with tough choices. Fund our schools, hospitals, justice and emergency management systems, and pave our roads. Which of these public services should we cut to provide this? At the end of the day, it's not about replacing a red line or a blue line. It's about replacing hazardous water lines, regardless of geographic location and social and economic conditions. Third, counties need early, consistent, and meaningful engagement with our federal partners to help develop clear and practical legislation and regulations that we can implement at the local level. Water systems across the U.S. are rapidly reaching the end of their lifespans. It will cost up to $1 trillion by 2030 to upgrade the nation's drinking water infrastructure. We encourage Congress and our federal agency partners to continue meaningful consultation with states and local governments on this rule to reduce the risk of unfunded mandates and produce successful strategies for implementing federal policies. Thank you again for the opportunity to testify and provide the county perspective on this proposed rule. We stand ready to work with our federal partners to develop policies to ensure every America has access to clean water. I'll be happy to answer questions.
Thank you very much, Commissioner. And finally, Ms. Wu, you are recognized for 5 minutes, please, with your opening statement.
Thank you, Chairman Tonko,
You're welcome.
Member Shimkus, and members of the subcommittee. My name is Mei Wu. I'm the Senior Director of Health and Food at the Natural Resources Defense Council. And as you've heard, there's no safe level of lead. And in fact, over the past few years, every state in the nation, with the exception of Hawaii, has had at least one water system that has had levels in its water that has exceeded EPA's action level. And so millions of Americans have been threatened with elevated levels of lead in their water. About 3 years ago, while government officials were refusing to ensure that Flint residents had access to reliable sources of bottled water and properly installed filters, Danielle found out that her young son Theo had levels of lead in his blood that exceeded the CDC recommendations for children under the age of 6. She found out also she had no lead paint in her home, but she did have troubling levels of lead in her water. So even though it was expensive for her family, they switched to bottled water. So Theo has been diagnosed with attention deficit disorder and other health problems, and his behavioral problems have caused him to be expelled from preschool. So as you can imagine, it's been a life-altering experience for this family, and you might think that Theo is one of the young victims of Flint, but in fact, all of this happened in Newark. And the Flint babies who were raised on lead-contaminated drinking water have now started reaching school age. And the city has found that the percentage of kids that have qualified for special education has doubled in this time. So the lead and copper rule and its implementation are broken. It's been broken for a long time, at least 20 years, when Washington, D.C. started struggling with its own lead in drinking water crisis. And so at this point, tweaks aren't going to get it done. We need a major overhaul of the lead and copper rule. And so NRDC will be submitting tomorrow detailed comments about the revisions, but I wanted to just highlight a few of the recommendations that we have today. First, EPA should streamline this complicated and confusing lead and copper rule. They need to set an enforceable standard for lead like they do for most of the other drinking water contaminants. It shouldn't be a treatment technology or a treatment technique that relies on corrosion control, but really just a maximum contaminant level for lead. Unfortunately, EPA's doubled down on this existing, difficult to implement, difficult to enforce, non-health-based action level, and has further complicated matters with a unenforceable and non-health-based trigger level. So that needs to change. Second, recently, actually, NRDC received an internal memo from Region 5 of EPA that talked about a lot of the problems with the lead and copper rule. And one of the things it mentions, and a lot of the things that you've heard today, is that EPA's revisions have ignored the elephant in the room, which is no matter how well corrosion control is run, unless you remove all of the lead service lines, and that means including the part that runs on private property, you're going to continue to have exposure to lead. And so full lead service line replacements have to be required, and they have to happen within 10 years. We just can't wait any longer. And unfortunately, under EPA's revisions, it could take 33 years or more if a system is triggered the requirement to even start replacing its lines. The other thing they need to do is ban the partials. Partial replacements are dangerous. They actually have been shown to show higher levels of lead than just leaving an undisturbed lead service line in place. And they need to be banned and prohibited. And the reason why partial lead service lines happen is oftentimes because the homeowners can't afford the thousands of dollars upfront and on short notice that would be required to pay for those lead service line replacements, or their renters and their landlords refuse to pay for it. And so the cost cannot be put on individual homeowners, because really what we're doing is exacerbating the already disparate burdens that are put on moderate and low-income families. And it really is worth the cost, because for every dollar that's invested in lead service line replacements, you get $10 of benefits back. And finally, the tap water samples that are used in the lead and copper rule have to reflect the highest levels of lead that's in the water. Data have shown that when you look at a series of sequential 1-liter samples of water, that actually it's the later samples, so when you're looking at the 5th liter or higher, where you see the highest levels of lead. And so you can actually find that those liters will have action level exceedances when that first liter didn't exceed the action level. But EPA, again, relies on this less contaminated first draw of water, and it ends up underestimating lead and showing maybe that things are fine when there actually is a problem. So thank you for this opportunity, and I look forward to your questions.
Thank you, Ms. Wu, and thank you to the entire panel for your opening statements and for your appearance here today. We're going to move to member questions. Before we do, we were asked to admit a news release from the Department of EPA that would be included in the official record. We will admit this press release to the record pursuant to the gentleman's request, but I must point out inaccuracies in the document. In the release, the EPA claims that my colleagues and I deliberately chose to exclude them. That is simply not true. We would have welcomed EPA's testimony here today. The release also suggests that other witnesses on the panel, those appearing here today, must have had received more notice of the hearing date. That is also not true. No witnesses received more notice than the EPA. We greatly appreciate the efforts that our witnesses today have made to testify here, and will again acknowledge working with the EPA on what is a very serious issue. So now to member questions. And I'll start by recognizing myself for 5 minutes. The area of safe drinking water, which obviously is a fundamental right and a fundamental duty of our federal government, is our focus here today. The public and many of my colleagues may look at the Safe Drinking Water Act and assume that it ensures drinking water that is indeed safe. This is a reasonable assumption, but unfortunately one that is not entirely accurate. I'm referring to the fact that drinking water standards set under the Safe Drinking Water Act are not health-based standards, but are actually based on cost. The recent proposed revision to the lead and copper rule is no exception. I would like to read a short quote from the proposed rule. And I quote, "The EPA established the lead action level in 1991 based on feasibility and not based on impact on public health. The proposed trigger level is also not a health-based standard," close quote. So, Dr. Hannah Atisha, do you think that we should have a health-based standard for lead in drinking water?
Absolutely. That is an excellent question. The EPA has actually set something called the maximum contaminant level goal for lead in water, which recognizes that there's no safe level of lead, and that is set at 0 parts per billion. The FDA, which regulates bottled water, has a standard of lead in bottled water at 5 parts per billion. The American Academy of Pediatrics, recognizing no safe level of lead, has recommended a maximum level of lead in schools and childcare facilities, and that water at 1 part per billion. We need to be moving towards a health-based standard that recognizes the well-known and undisputed science that there is no safe level of lead.
Thank you so much, Doctor. And Ms. Gaddy, do you agree?
Yes, most definitely. It is crucially important that this issue that a lot of our residents face in environmental justice communities, it's a health injustice. And then there's cumulative impacts that we suffer from on a daily basis. Just because of the zip code that we reside in, there are other air issues attached with water issues. So we definitely need this to be a health related concern with a sense of urgency.
Thank you. And to anyone on the panel, what would a lead and copper rule look like if it were based just on health protection instead of cost? Anyone? Ms. Wu, I think you wanted to respond.
Well, it would look like some of the things we've outlined, which is it would take away all the lead service lines that are the cause of the problem, and it would ensure that people's homes, that the water that's coming into their homes is safe to drink.
Okay. Anyone else? Doctor.
Sure, I would just reiterate that. So in lead, the public health and the pediatric and the medical community advocate something called primary prevention, which in public health means we're never supposed to expose a child to lead. So it would be putting in the place the recommendations that eliminate that exposure, eliminate lead from our service lines, maximize corrosion control so that lead never gets into our drinking water, and then we never have to wait to find it in our children.
Mm-hmm. Do any of our reps from water organizations want to? Yes, Ms. Licata.
Yes. I really believe that it would firmly look at a more integrated approach. I think you've heard from the testimony today that an interdisciplinary approach among agencies as well as the water providers is really necessary in order to address this problem. One of the comments that was made earlier is that the utility can't simply assume authority based on the rule. There are prohibitions against our addressing some of the private sector. We can't force our way into schools. So we would really have to look at this in a more holistic manner and really integrate the approach.
Thank you. Feasibility is an important consideration in adopting regulations, of course, because a regulation that cannot be implemented will not improve public health. But we have seen across our environmental laws that protective regulations can drive innovation, making better technologies feasible. For lead in drinking water, we have EPA saying that what is feasible in 2020 is no better than what was feasible in 1991. Ms. Wu, do you agree with that, or can we do better than 15 parts per billion?
Yes, I do think we can do a lot better, and I think if you look at examples of the cities across the country who are starting to do full lead service line replacements at no cost to the homeowners, it shows that it is feasible and it can be done and it should be done.
Do you know what some of the other countries might do in regard to lead levels?
Other countries?
Yeah.
I am not.
Okay. Oh, doctor.
My understanding is that the World Health Organization has an action level of 10 parts per billion.
Okay. Thank you very much. I will now recognize Mr. Shimkus, Subcommittee Ranking Member, for 5 minutes to ask questions.
Thank you very much. I'm going to go by Dr. Mona. And if the World Health Organization says 10 parts per billion, why not 0? Why aren't they saying 0? If everyone says there's no safe level.
I completely agree. It should
There-
be 0.
Okay, there must be a reason. I wanted to start with pointing out those 2 young children back there in the second row. Can you want to introduce them, because I think they're related to you?
I have my daughter, Nina, who is an 8th grader in Michigan who's studying U.S. history, so we thought we'd get a hands-on lesson, and my nephew, Zachary, who lives in Northern Virginia. I wanted to see his aunt testify.
Well, let's welcome them here.
Thank you.
I was a former teacher, so this is like,
I also have a Flint kid with me, Jasmine, over here, who works with us at Michigan State University.
all right, Civics 101 right here.
A Flint kid, that's okay.
So let me, thank you for that. Let me go to Mr. S.D. Smargiassi. I'm a former Army infantry officer, and we have the KISS theory, keep it simple. This is very complex. Could you, you went over a lot of this debate, and can you kind of explain why it's a difficult process in infantry language? And then maybe follow up with the practicality of an MCL for lead.
So let me sort of start off with corrosion control and then talk about lead service lines. One of the things we worry about in any change in regulation is that any change in treatment, any change in source water, anything we do in the water system, we have to evaluate all the rest of the factors. In fact, a number of the situations where we've seen elevated lead, it wasn't because, in some cases it was, but in other cases it was not because folks were negligent about thinking about lead, it's that they were very active about thinking about another contaminant, whether it be disinfection byproducts or Giardia, cryptosporidium, and those changes to fix one problem can cause another. As much as we'd like to think we fully understand corrosion in water, EPA's experts and academic experts frequently disagree with each other and frequently don't have a practical answer for whether a tweak in one thing will cause a deficit in something else.
Yeah,
We worry about that.
And we've seen that too, just on power utilities, where we try to get a cleaner burning to kill the particulate matter, but nitrous oxide goes up. So it's one event affects another, and that's why I appreciate that. That's difficult. So let's go back to Mr. S.D. Smargiassi, Ms. Tucker-Vogel, and Ms. Licata. Some of my colleagues have publicly dismissed this proposed rule. Given the challenges from your perspective, do you see the administration's proposal as generally addressing the right issues, and if not, at least suggesting a serious and workable proposal? Let's go to Ms. Licata first.
I think there are a lot to begin to work with in this rule, and we would really look forward to working with the administration on it. Particularly, we like the part of the no partial replacements unless you have a significant emergency repair. We think that that makes great sense.
Okay, let me go to Ms. Tucker-Vogel real quick. Same question. Anything good, about the rule?
In the proposed rule?
Right.
Yes, I think requiring the lead service line inventories is a good first step, and I think, it's fundamental to the rest of the rule.
Okay, let me go to
Don't know
Mr.
where
S.
the lead is, you can't fix anything else. so.
Okay, thank you, Mr. S.D. Smargiassi.
Inventories, plans to remove them, and letting every homeowner know that they've got a lead service line if they have one and encouraging them to replace it.
So let me-
Information is power.
Yeah, time is short. So let me go. Who has submitted formal comments for the rule yet? Raise your hand if you have submitted formal comments. Is that a yeah? So you have not submitted them yet tonight? And you have, Ms. Gaddy? Okay, Ms. Tuck. So some of you here testifying haven't submitted to the rule. NRDC is going to, I guess. And it's due. So if you're going to do it, you better get it in. And a revised rule better than no rule? In other words, you know when the last rule was written or promulgated? 1991. I was here during the Obama administration, came in 2009, left in 2017. Did they promulgate a new lead and copper rule? The answer is no, they did not. So cut the administration a little slack for trying to do something versus nothing. And I yield back my time.
Gentleman yields back. The chair now recognizes Chairman Pallone for 5 minutes to ask questions, please.
Thank you, Mr. Chairman. Many of you stated in your testimony, and I saw serious concerns about EPA's long overdue proposal for the lead and copper rule. So I wanted to highlight a few of these concerns that we can work with EPA to address them in the final rule. And the first concern is that this proposal does not do enough to prevent lead contamination. So let me try to run through this quickly. Dr. Hannah Atisha, why is prevention so important when it comes to lead exposure?
Sure, that's a great question, and that's really fundamental to why we are all here. Why is lead bad? It is, like we've mentioned, a potent, irreversible neurotoxin. So what that means, it attacks the developing brains of children. It impacts cognition, lowers IQ levels. It impacts behavior, causes things like developmental delays, attention problems, focusing problems, hearing loss, growth problems. It's been linked to impulsivity and criminality. We also now know it has multi-generational impacts. There's a recent book out on lead that called Lead a Multi-Headed Hydra, because wherever you turn, there's like a new research study that says there's something bad, that another bad.
When you say multi-generational, you mean can hand it down from one parent to their children?
Absolutely. Research from Detroit shows the epigenetic impact of lead. Grandmothers exposed to lead, you can see those DNA changes in their grandchildren. We also know that children exposed to lead as adults can manifest with high blood pressure, kidney disease, early dementia, gout, and have other life-altering consequences.
Sounds pretty bad. I mean, obviously, I don't think this proposal does enough to remove lead service lines. What should we do to prevent exposure through drinking water?
I think, once again, the many things that we've talked about, we should find where the lead is, and we should get it out. We should get rid of our lead in our service lines. It's going to be very difficult to get rid of the lead in our home fixtures and faucets, but we can minimize that risk with better corrosion control treatment, with better public education. People can use filters if they choose, if they're concerned, better testing, better transparency. So like many of the things here, we need to this rule should be based on the concept of primary prevention, public health, not on feasibility and what saves money.
Now, let me ask Ms. Gotti, do you think a community can solve lead contamination without removing lead service lines?
No, we must start first with removing all the lead service lines and making sure that individuals are informed of where they exist, and then provide the necessary finances for them to be removed.
Now, of course, I'm thinking of Newark in our state, which is undertaking this aggressive replacement of all lead service lines. And I think we can see in coming years that decisive action would offer robust protection for public health. Yet this LCR proposal maintains the structure of the old rule where action is only required after a problem is found. And I think we'd have to do everything we can to prevent lead contamination, not just remedy it. So let me ask Ms. Wu, when should lead service lines be replaced? Does it make sense to wait until monitoring shows that they're leaching? And, do you think that EPA should adopt a proactive lead service line replacement requirements instead of this reactive approach?
Absolutely. I think we need to start pulling them out of the ground now. And as we've seen the monitoring and waiting for monitoring, as all the flaws in that mean that we might think there's no problem because it's not showing up in the leader that we're looking at, where actually you do have a big problem. So this wait and see is the worst way to do it. We have to be proactive about it.
I'm going to run out of time, but I want to ask about this trigger level below the action level. The proposal takes a small step by introducing a trigger level below the action level, but it seems kind of confusing to me. So let me go back to you, Ms. Wood. Do you think the EPA should require corrective action for lead levels below 15 parts per billion?
Yes, I mean, as we know.
Basically, I'm asking whether you think the trigger level is enough, or should the action level be lowered?
No, it needs to be lower. It needs to go as low as possible. 5 would be way better. 0 would be great, but yes,
right.
It needs to be lower.
Let me just ask in the 30 seconds, Dr. Hannah Atisha, do you agree with what she said? And Ms. Gatti, do you agree?
Yes.
Ms. Gatti?
Yes.
Okay. So that's it. I mean, I think that we all agree that EPA should lower the action level and require proactive lead service line replacement. I don't think we can undo the effects of lead exposure, so we have to do everything we can to prevent it. And as costly as lead service line replacements are, the alternative is far more costly for impacted communities And I just want to thank you, for your testimony. I yield back, Mr. Chair.
The gentleman yields back. The chair now recognizes Representative McKinley for 5 minutes, please.
Thank you, Mr. Chairman. Several of you have come close, but then you stopped. We've been doing research to try to find out how many homes were built that still exist since prior to 1986. Because in 1986, we had the ban on lead pipes and solder and lead solder in our homes. But I can't get a number of homes that are still out there that where families are at risk. And so if you can get that, now then but Ms. Wu, I thought you came close a little bit to it too. Was do we have a number? Is there what are the metrics on the projection? Because there'll be tens of millions of homes. If we got about 100 million homes out there, I'm going to say maybe 40 or 50 of them, we could figure out that. That's what I'm trying to find out. How many homes out there have exposure? So what is the projection to remove the lead-based pipes, fixtures, solder in our residential homes? Does any of you have that number, or is this just something we just whine about?
Well, you want to?
I guess none of you.
There have been
One of you
estimates.
just take a shot at this.
Yes, the best estimate we had for lead service lines is between 6 and 10 million homes have lead service lines. That number obviously could be improved, narrow up the range. In
You're
addition
saying
to
service
that-
lines are coming into the house. I want to know
Service
how
line,
many are in the house. How
Well,
that physically homes built prior to 1986 we'd have a lot of homes in there would not have copper necessarily in it.
Many tens of millions.
tens of
more than-
millions.
Many tens of millions more.
Tens of millions. So I'm trying to find out what is the projected cost. Is it $5,000 a house, $10,000 a house? I don't know what that. I know what it would be for mine because I've had the estimate on it. But I'd like to know so here's what I'm going for. We give, and we've been talking about this for years. I'm an engineer, a licensed engineer, and we've been dealing with this in homes and apartments all over in our project. Why aren't we offering a tax credit? Why aren't we offering a tax credit for people to be able to remove these, or grants? Now, one question came up, it was a question what are other countries doing? I believe it's Ireland is offering grants to remove lead pipelines in homes. So in America, why aren't we doing this? Look, if we give tax credits for residential energy tax credits, that deals with high efficiency boilers, furnaces, solar panels. We'd have historic preservation tax credits. We have tax credits for mortgages, state and local income taxes. We have tax credits for home office deductions. But we don't offer one to remove lead-based pipe, which is far more dangerous to people. Now, Ms. Wu, you said it was a 10-to-1 ratio. Maybe it is. I don't know what that is. That might be able to give us some strength if we were to go for that, to be able to promote something that it will pay for itself if we were to use a tax credit. So I want to also engage you because I think if we can get to that, and many of you referred to it as the elephant in the room. To me, the elephant in the room is a homeowner and his pipeline. You get him engaged, him or her engaged in this debate by cleaning theirs up and then saying, but it's you, the communities, I'm sorry, Ms. Bobbitt, the counties to do it. I think we can get more pressure put on the counties and everyone to do this. But if we put pressure on the counties to do it, then it's going to put pressure on them. They're going to resist it because for whatever reason, they can't afford to do it in their homes. So I want to give them if we offer all these tax credits for everything else, why in God's name aren't we doing the same thing for lead-based pipe in our homes? And we ought to be able to do that. So is there any thoughts on that?
Well, I just wanted to add, I know in the city of Newark, the average cost is $7,000 to replace a lead service line. We have 18,000 lines that are being replaced that will cost about $126 million.
That's the service line. I'm talking about inside the house, which is going to be more expensive. You might have to rip out some walls. You can have some problems in there. So some other comments. Dr. Hannah?
So service lines were restricted in 1986. Most communities weren't actively putting them in, except for Chicago, which mandated using lead service lines to deliver drinking water. However, our home fixtures were allowed to have lead in them
Yes.
until 2014. So lead was allowed in brass fixtures until 2014. It is going to be very difficult to rip all that out, and that is why, in addition to lead service line replacement, we need that optimal corrosion control and other preventative measures.
Okay, my time has expired, but I didn't see any of you saying, I like the idea of tax credits. Sorry. I yield back.
Does anybody want to talk about that tax credit, just a yes or no, before we go to our next?
I
Commissioner?
think a tax credit would be very good.
Okay, thank you. There you go, David. So we got one.
Thank you for your cooperation.
So we've made Representative McKinley somewhat happy. So, okay, the chair now recognizes the vice chair of the full committee, Representative Yvette Clark, for 5 minutes, please.
Thank you very much, Mr. Chairman. I thank our ranking member, Mr. Shimkus, for convening this timely hearing on the EPA's recently proposed revisions to the lead and copper rule. Thank you as well to all of you, our witnesses, for being here today. Brooklyn, New York, which is where I hail from, is very fortunate to have some of the cleanest drinking water in the nation, thanks in no small part to the work of our Department of Environmental Protection and our upstate partners. But even in Brooklyn, we're not exempt from this national crisis that has called our drinking water system into question, particularly in our public schools, where drinking fountains have had to been shut off to prevent our children from lead exposure. Much of our infrastructure is very old, and many of our buildings were constructed during the time period when lead was used in service lines without even a second thought. So I wanted to raise a couple of questions, but let me start by letting the committee know that I received an internal memo from my colleague, Congresswoman Diana DeGette, and it's a 2017 EPA memorandum that discusses lessons learned in implementing the lead and copper rule in the older industrial cities of the upper Midwest. Lessons that I'm afraid that have gone unheeded by the EPA in drafting this new particular proposal. Copies of this memo was provided to the Democratic and Republican offices of this committee last night, and I ask that the memo be entered into the record.
Without objection.
According to the memo, sampling just the first liter of water to come out of the tap rather than the 5th or 10th liter missed the peak lead values 100% of the time. So, Ms. Wu, could you elaborate on this and tell us whether this problem has been solved in this upcoming proposed rule?
Yeah, unfortunately, it hasn't been solved, and EPA continues to rely on the first liter, whereas, the studies have shown that the water that comes out from, say, the 5th liter and on is actually closer to the lead service line and more reflective of what's happening in the lead service lines.
Okay. The memo points out that neither the states nor small or medium water systems have the expertise to establish optimal water quality parameters that will ensure lead levels are well controlled. Ms. Wu, is this problem addressed in the EPA's proposal?
No, that is also not addressed.
The memo points out that a lot of water systems don't know where their lead service lines are and thus may be missing high lead levels when they go out to sample. Ms. Wu, is this problem addressed in the EPA's proposal?
It is not fully or well addressed in the revisions.
So this memo says even the best centralized treatment used by a public water system may not prevent the release of lead particles that can be up to 97% lead. Ms. Wu, is this problem addressed in the EPA's proposal?
No, that problem is not fixed in the proposal.
The memo points out there may be elevated lead levels in homes even if the overall system has not had an action level exceedance. So, even though Chicago's water overall is above the action level, there may be more than 4,000 homes drinking water containing 15 parts per billion of lead, which is the action level, and 1,000 homes drinking water with more than 100 parts per billion of lead. Ms. Wu, is this problem addressed in the EPA's proposal?
No, that problem has not been addressed.
So this report came out in 2017. None of this has been included in this upcoming proposal. These are things we already know. So, Mr. Chairman, we've had a tragic history in this country with lead in drinking water. Unfortunately, it seems as though the EPA does not seem to have learned from that history. Mr. Chairman, I'd like to, again, make sure that this is put into the record, and I'd like to thank all of our witnesses for being here and lending their expertise. With that, Mr. Chairman, I yield back.
The gentlelady yields back. The chair now recognizes the ranking member of the full committee, Mr. Walden, for 5 minutes, please.
Thank you, Mr. Tonko. Appreciate that. And again, thanks to the panel. Mr. Estes Smargiassi, do the proposed revisions to the lead and copper rule create a more deliberative process regarding corrosion control and system management than currently exists under the lead and copper rule?
The proposed rules add a fair amount of additional detail on how systems ought to think about this. They've focused on medium-sized and smaller systems rather than just large systems. So there is additional focus on corrosion control as one of the, if you will, the legs of the stool that we need here, along with lead service line replacement and public education. It adds a lot of complexity, which does concern us, but I think the thrust of encouraging corrosion control makes sense.
Okay. Let's see here. Commissioner Bobbitt, according to your testimony, it appears that counties have many responsibilities and roles within your communities regarding public health protections. I think we all know that. Would you please explain what some of these are, though?
Yes, thank you for that question. We are responsible for about anything that touches our counties, our people. So we take care of 911, roads and bridges. We run elections. We do so many things, and it's important. We're also very smart, and we work in partnership, and that's why it's real important for us is to work in partnership with our federal, state, and local governments, because as counties, we all need to be at the table to figure out what we need to do for our clean water.
Mm-hmm. Again, back to Mr. Estes Smargiassi and Mr. Tucker Vogel. What are your views as to what will help accelerate line replacement and will encourage replacements of customer-owned lines? I talked about some of that in my opening comments.
So one thing that will help accelerate it is knowledge. So the requirements for inventory and public education and notice to homeowners is going to make it more likely that folks who have a lead service line are encouraged to remove it. There's been a fair amount of conversation here about funding. That's probably the big gap in all of this. My numbers say if we're just thinking about lead service lines, we're talking about $30 to $80 billion across the country.
Wow.
This proposal also adds in the galvanized lead service lines preceded by lead gooseneck. In my region, there's about twice as, that adds doubles the number. So if we look at it that way here, we might be talking about something on the order of $160 billion to deal with this. The places where we've had real success have been where there's been external money applied.
Sure.
Flint did a great job with a lot of money from this organization here.
Yeah.
If somebody gave us a couple $100 million, we'd be able to move a lot faster in doing ours.
Mr. Tonko has the checkbook. Ask him. He's happy to do that, I'm sure. You may have covered this. I was out of the room at the other hearing, but what do you tell the average homeowner? What's my responsibility as a homeowner? How do I know whether that service line coming in or not is something I should replace? Is it my responsibility? At what point do I start when the water gets to my house or there to the street? Who can take that on?
So I think it varies from utility to utility and also from state to state. But in general terms, the responsibility for the service line from the meter to the foundation of the house typically lies with the homeowner.
Got it.
Now, sometimes the meter might be in the house. So then there again, it's just the whatever the policy of the water utility might be at that point. But to go back to your question of how do we communicate with and educate people about what their materials are, the inventories are the first and fundamental part of that, both on the utility-owned side of the meter and the privately owned.
But how does a homeowner know? How do I know in my home?
Well, it's going to take an educational effort. That's got to be part
Is
of
there
the
a simple
rule.
test? I mean, if you're painting there, you scrape some of the paint and you can, do the lead test. I've done that. But
Well-
you can't do that. With
Well, keep in mind, the lines are buried.
right.
So
No, I know.
sometimes depending on how the lines are connected to the meters,
Right.
sometimes you can tell they're at the meter set. And you can do a little scratch test and see whether it's lead or not.
All right.
But there again, it's going to vary depending upon how it's constructed.
And on copper lines, I know they used to use lead solder, right? Is that an issue people should be worried about as well?
It could be. There again, it depends. They don't use lead solder anymore.
Yeah, but they
So as long as their water's not really corrosive, it's probably
the
okay.
issue is-
I have lead solder on my copper pipes in my house, so but they're old and my utility uses corrosion control.
Got it. Okay, thank you. Thank you all, and thank you, Mr. Chairman. Appreciate it.
You're welcome. The gentleman yields back. The chair now recognizes Representative Blunt Rochester for 5 minutes, please.
Thank you, Mr. Chairman, and thank you, Ranking Member, and to the panel. I'm sorry I've been running back and forth up and down the stairs. I'm on at the same time in another hearing. So I would love to, I might have to submit some questions for the record, but I want to first thank you and just express that yesterday we know the President released his FY21 budget. And a budget is really a representation of your values and your priorities. The proposed budget would lead people to believe that we don't value our environment as much as we do, or our health. And based on the last 3 years, this is not really a surprise. The administration has rolled back, or is in the process of rolling back, nearly 100 safeguards for our air, water, and health. And for the 4th year in a row, the Trump administration has proposed deep, draconian cuts to EPA's overall budget, this year reducing it by nearly 27%. Since EPA was created in 1970, under a Republican administration, our health and our environment are not partisan issues. It has made our air and our water cleaner, prevented millions of asthma attacks and hospitalizations, and avoided hundreds of thousands of premature deaths. So when looking at this lead and copper rule proposal, it goes against the very essence of what the EPA is supposed to do: protect our environment and protect our health. And unfortunately, when the EPA fails to do its job, those impacts fall disproportionately on the poor and communities of color. What happened in Flint is sadly just one example of what's happening all over this country, including the state of Delaware. We know how horrible lead is for our health, even at low-level exposures. Children and pregnant women are especially vulnerable. And this new rule fails to protect the millions of Americans who drink their water from systems with lead and copper pipes, and that is unacceptable. It also fails to require adequate procedures for notifying a community of a contamination, which is a fundamental right and especially important for environmental justice communities. Ms. Gaddy, in your testimony, you highlight that Newark, New Jersey had difficulty communicating health risk and technical information concerning lead levels to the public. We hear a lot about the concern for creating a panic in revealing lead level exceedances too quickly. Do you think that the people impacted by contamination in Newark should have been notified sooner? And in your experience in Newark, does panic arise from too much information or too little?
Yes, well, thank you for that question. And I do think that too many of our residents were not informed of the situation early enough. And then when the information came out, it was too much to comprehend at one time. So then there was a sense of panic. In order for individuals to fully engage and understand what is happening and how serious this is to their health, you had to first kind of explain what the problem was. It was 15,000 service lines at first. It wasn't everybody in the city. So when you begin to say, well, only these groups of individuals can receive a filter or are in jeopardy, their health is jeopardized by potential lead, so now the other 50,000 in that particular ward or 75 in another ward is like, why not me? And so then it created this whole confusion, but there was a lack of transparency up front as well. I do believe that there was missteps along the way. There was a lack of communication between the administration and the health department, because this was a health issue that should have been addressed from the health department as well as with the water department. And because there was disconnects along the way, individuals didn't connect that this is something that is poisoning my family.
Thank you, and I'm going to shift to Dr. Hannah Atisha, following along those same lines. Do you agree that it's important to inform residents? And also, what's the difference that a timely notice can make in exposure to lead to children and to the harm that could be done?
Absolutely. We definitely need more transparency, more communication. After Flint happened, in a bipartisan manner, Congress passed the EPA notification bill, which says that if there's lead in the water, people should be informed of it. It's kind of crazy that we needed a bill for that to happen, but this is a step in the right direction. People need to know if there is a concern so that they can take the proper measures to protect themselves.
And I'm going to ask Dr. Wu, does this proposal ensure that EPA will notify people impacted by lead contamination as soon as possible?
No, it could do a lot more to make sure they get notification in time.
And in your testimony, you highlight that sampling requirements are weak and that repeated sampling frequently identifies lead levels that were not identified in previous sampling efforts. You propose that sampling should be taken from every tap in schools and child care facilities twice a year. What is your recommendation for frequency of sampling done outside of schools and child care facilities?
Well, for the frequent, I mean, first and foremost, the most important part is to take the samples that are from the leader that shows what's happening in the thing, or in the lead service line, right? And so that's most important. And then the frequency of sampling is, more frequent is always going to be better.
Thank you. My time has expired, and I yield back.
The gentlewoman yields back. The chair now recognizes the gentleman from Missouri, Representative Long, for 5 minutes, please.
Thank you, Mr. Chairman. Thank you all for being here today on this important subject. And Ms. Tucker-Vogel, unfunded and underfunded mandates have always been a concern for states, and proposed revisions to the lead and copper rule offer no additional funding for states' implementation of federal requirements. What impact would this rule have on the state finances for drinking water programs and enforcement?
Well, it will have a significant impact. I think if you look at the full testimony that we submitted, and also our comments that ASWA submitted with the lead and copper rule, you will find that the increase is significant, and without additional funding from EPA, I'm not sure how we will be able to fully implement the rule. Also, replacement of the lead service lines, both on the public and private side. There'll be additional funding required for that as well.
Assuming that the public water systems supervision grants are fully funded at $150 million per year, would states be able to fully implement the proposed rule as well as all of the other items that are required to do part of their primary enforcement responsibilities?
So I'd like to reiterate that states will not be able to implement this rule at all if we don't have a functioning data management system, which we currently do not have, either at the federal or state level. Our Safe Drinking Water Information System, otherwise known as SIDWIS, currently does not have the capability for us to track all of the new requirements that are in the proposed regulations. So that's a significant issue for states.
Okay, thank you. And Commissioner Bobbitt, according to your testimony, it appears that counties have many responsibilities and roles within your communities regarding the public health protections. And I know that Chairman Walden earlier, Ranking Member Walden, this committee, I guess, but Ranking Member Walden asked you a little bit about this. But with competing demands, how do you prioritize all the services in your community?
Thank you for that question. That's a great question because it's a very difficult task. But like everybody else, we have to balance our budget the same as you do in your home and at your budget, and the same as our federal government has to balance their budget, and our state has to balance their budget, so do counties. So we have to prioritize. Obviously, we look at safety first, and we're always very proactive about looking at what is impacting our environment. So we have to prioritize it, but we do look at safety first.
Okay, thank you. And Ms. Tucker-Vogel and Ms. Licata, Both of you raised concerns about the proposed regulatory revisions regarding making public water systems responsible for testing drinking water at school and child care facilities, which we all want, of course. Ms. Licata, what technical coordination and or funding challenges might this approach pose for water system operators?
Yeah, so we, as a utility for New York City, are greatly interested in supporting the schools and daycare centers to the best of our abilities with testing and the knowledge of what may exist within their facilities and where they may have their lines. We think that there could be additional funding for those types of facilities. We do know that the Congress in 2016 through the WIN Act created a grant program. There's about $45 million that may have been provided at this point, but we do need EPA to stand up a program that could administer the funding. We've heard it's a drop in the bucket, but the very next step is to stand up a program that would allow for potentially grants to be administered.
Okay, thank you. And Ms. Tucker-Vogel, why should state education departments and child care licensing agencies be responsible for drinking water matters when they are in the schools?
So state education departments and schools are responsible for the safety of the children that are in their care, both in the schools and in child care facilities. I think it's important to note that drinking water operators at water utilities don't have the expertise that it takes to look at premise plumbing. So once you start looking at premise plumbing within large institutional buildings, it's a very different expertise that's required than what is required to operate a drinking water system. And I don't think our operators at this point have that level of expertise to address premise plumbing issues.
Okay, and with that, I yield back 5 seconds. Thank you all.
Thank you. The gentleman yields back. The chair now recognizes the gentleman from Florida, Mr. Soto, for 5 minutes, please.
Thank you so much, Mr. Chairman. You know, getting lead out of our water is pretty fundamental. It's been a challenge for thousands of years for humanity. I was reading the other day that the fall of the Roman Empire was even contributed in part because there was lead in their pipes that drove people insane. And then we had lead in our piping until the 1920s in a lot of cities. But until the 1980s, I couldn't believe that, until the 1980s in national plumbing codes, there was lead. We know this is a hard issue. We've had issues like asbestos that we are working on and PFAS and even getting lead out of gasoline in the 70s and 80s. But we can't avoid it because it's hard. I worry about my own state where 80% of the children with lead poisoning were not tested by their local health departments, according to Pediatrics Medical Journal. And then I just met with my Florida rural water folks last week, and they're volunteering to help out schools and daycares because there's no state money to be able to test our many thousands of schools in Florida. So first, I wanted to ask everybody's response. We saw the president's budget this week, 26% cut to EPA. Those 50 programs that are targeted for cuts are radon, clean water, and the lead program. So it'd be great to hear what that would mean to each of your communities if we had a 26% cut to the existing lead programs that we already are funding in the 2020 budget. And we'll start from left to right with you, Mrs. Anastasia.
So the lead programs, the safety net programs, all these programs that are critical for the health and development of our children and of our families, they're already underfunded. If you look at our lead programs, the Childhood Lead Poisoning Prevention Program with the CDC, they got some of their funding restored with some of the Flint dollars that came in, but that's still not at what it needs to be to properly identify the children that are exposed, but really to focus our work on primary prevention, not only getting the lead out of our homes, but getting the lead out of our plumbing. We talk a lot about costs. Cost has come up many times today, and we're not talking about the cost of doing nothing. We well know the cost of inaction. There's been studies from the Pew and Robert Johnson Foundation and even studies in Michigan that tell us the burden of not eliminating lead exposure. It costs us about $80 billion a year. when we look at decreased economic productivity, special education costs, criminal justice costs, healthcare costs, and behavioral healthcare costs. That is the cost of continuing to kick the can and continuing not to eliminate these kind of exposures.
Sure. Ms. Gaddy, what would a 26% cut to the lead program mean for places like Newark that you've been talking about today?
Well, there will be a lot of services that residents would not receive, and again, I concur with Dr. Hannah as well. Not only the lead in our drinking water, but lead paint chips, dust, all of those things and those programs need proper funding from EPA. It also means that individuals, over the lifetime, children will be exposed to more illnesses based on the lack of safe and affordable drinking water, the lack of individual air issues that's also associated with it. I mean, 1 in 4 children in Newark have asthma. We have cumulative impacts of just total, so many toxins, the air we breathe, the water we drink, the food we eat. So the 26% cut would hurt us tremendously in our community, and the damages will be irreversible. So children will have a lifelong of health effects from an early age until they're adults.
Sure. Ms. Licata, what would it mean for New York City to have that kind of cut to the lead program?
We would be very concerned about deep cuts to EPA, but I would frankly be most concerned about deep cuts to the SRF programs for the states, because my utility relies greatly on that source of financing, which really allows us to access the markets at a very good rate. And frankly, I think with respect to budget cuts there, I think we have hearing today that we do need some out-of-the-box opportunities to address the costs associated with removing lead from homes, and I hope that we could talk about that some more.
Sure. Ms. Tucker-Vogel, what would it mean for Kansas if we had a 26% cut to the lead program for EPA?
So, well, first, I'm here representing ASDWA, but the lead program is not in the drinking water program in the state of Kansas, and I doubt that that's the case in most of the state drinking water programs, that lead program's located in another part of an agency. So I would echo the concern, though, about cuts to both the Public Water Supply Supervision Grant and the SRF programs, which do directly impact the state drinking water programs and allow us to work towards reducing lead in drinking water.
Thanks. My time's expired.
And perhaps the other witnesses can respond in writing to acknowledge Representative Soto's question, which was very good. Next, the gentleman yields back. Next, the chair will recognize the gentlewoman from Michigan, Representative Dingell, for 5 minutes, please.
Thank you, Chairman Tonko. And I'm sorry to all the panel. There are 2 hearings that are equally important, especially for Michigan, because it's autonomous vehicles downstairs. But we've all been bouncing up and down because we care deeply about both issues. But I thank the chairman for holding this hearing. And as you've heard all morning, and as you know, this really matters in Michigan. And I would reinforce again, it's on each one of us here in Congress and a government to ensure that no city in America ever experiences what Flint experienced again. We've witnessed it. I've seen the children. I'm following the children. It matters on the adults too, but as I talked about earlier when I introduced Dr. Mona, I'll never forget those kids when I first, and the desperation of those parents. And it's really clear that government at all levels failed the people of Flint. Now we've got a moral obligation to fix it. And I have felt that from the very day that I first went to Flint, and the ACLU, before it ever became public, started talking to me about what happened. And that's why a strong, proactive, and clear federal lead and copper rule is needed for the long term to protect Americans all across the country. I'm going to address my first set of questions to Dr. Mona. I call her Dr. Mona because the kids call her Dr. Mona. And I should maybe be more respectful, but I trust kids more than I trust adults some days. Sorry. But in your testimony, you stated that EPA's proposed revisions to the lead and copper rule are minimalistic and insufficient, which I agree with. Given your expertise and your experience in Michigan, I want to direct a series of questions to you. First, can you describe for the committee why there is no safe level of lead?
Yeah, we talked about that briefly before. It is a neurotoxin. It impacts cognition and development and behavior and has life-altering, multi-generational, multi-system consequences. Very clear science, which we've known for hundreds of years, back when the Romans used lead, now tells us that there is no safe level.
So having said that, and we've talked a little about it, and we keep dancing it, but we got to stay on it. What do we do to protect our most vulnerable, which is our children and pregnant women?
Right,
What is the most direct thing we do?
That is a great question, and that is how this rule really should be focused on, and that should be that focus on primary prevention, doing everything we can to not expose children. Not only does it make health sense and development sense, we also know it makes economic sense.
So what makes lead in drinking water different than, say, lead from a lead pencil or from paint?
Yeah, that is a great question, and that's something that I had to learn as a pediatrician, despite caring for hundreds of children with lead poisoning, both in Flint and in Detroit prior. Lead is different. Lead in water is different than other traditional sources of lead. Lead paint and lead dust. Kids are highest risk of exposure to those household sources when they are crawling and walking. Usually, when they're toddlers, they walk around, they crawl, they find a paint chip, they put in their mouth, and paint chips are actually sweet, and so they continue to eat them. Lead in water impacts a different age group. It impacts the unborn, has well-known maternal fetal impacts, including miscarriage, fetal death, prematurity, small birth weight, and it most impacts babies on formula. We have so many babies in Flint who are formula fed. We have low breastfeeding rates, and they were using this lead-tainted water to mix their formula, which is a powder. So the age group of exposure is different than the other sources of lead, and also, unlike the other sources, lead in water is in a vehicle meant for us to ingest. Like, we're not meant to eat dust and paint. Kids do it, but we are meant to drink water. It is a medical and public health necessity for us to consume water. And when lead is in it, we can't see it, we can't taste it, and we don't know what's in there.
So now let's take it to another step. So what's the difference between lead exposure in schools and in daycare versus exposure in homes? And what do we need to make sure the kids are getting safe drinking water in schools?
Sure, that's a great question. So lead in schools and childcare facilities are a little different than lead in homes. Usually there's not lead service lines to these bigger buildings. The lead is coming from fixtures and faucets. Lead in schools usually is increased because there's long periods of water non-use, for example, weekends, overnight, breaks, which concentrate the exposure of lead. So that first kid that comes in on a Monday morning, turns on the drinking faucet, they're going to get a gush of lead in their water. So that's what makes it a little different. And we have poorly invested in the infrastructure of our schools. And this is another reiteration reminder of why we need more capital investment in our schools to get them caught up.
Thank you. I yield back, but I will have some questions for the record, Mr. Chairman. Thank you to all of you.
Thank you.
The gentlewoman yields back, and the chair now recognizes the gentleman from California, Dr. Ruiz. Representative Ruiz, for 5 minutes, please.
Thank you very much, Mr. Chairman, for holding this hearing on such an incredibly important topic. Thank you all for being here and for your advocacies and your voice in this public health dilemma. The health and safety of our children is the most important aspect of keeping lead out of drinking water. The health and safety of our children, okay? The health and safety of our children should be our objective, not some cost-benefit equation and feasibility and for an agency. Lead is a potent toxin, a known threat to public health with serious impacts on cognitive development in children. And there is a broad consensus that no level of lead is safe. No level of lead is safe. As a parent of twin 4-year-olds, would I consider a certain level safe for my children to drink? Would I accept a certain amount of lead for my children to drink if the medical community is saying no level of lead is safe to drink? I would definitely not. I'm a physician, so I'm going to ask Dr. Ana Atisha, you're a pediatrician, correct? Can you tell us what health impacts you found in your patients during the Flint lead crisis? What led you to even test for this?
That's a great question, and it's part of the nuances of lead. So I shared kind of the consequences of lead exposure, but those don't present right away. Kids don't come into the clinic with those acute symptoms. I wish they did. I wish a kid who was exposed to lead had like purple glow-in-the-dark spots, but they don't. And in pediatrics, we call it a silent pediatric epidemic. It's pernicious. It's invisible. We don't acutely see symptoms of exposure, which is why, unfortunately, we are then left to screen children at the ages of 1 and 2, because that's when they're most at risk for household lead exposure, for lead in their blood. But when we do that, it's too late. And when we do that, we are literally using our children as detectors of environmental contamination.
So-
We should be screening the water in their environment.
Is that a mandatory screening, or is that your practice, or is that a state mandate?
It's different in every state, but it's a Medicaid mandate that if a child's on Medicaid, they have to be screened at the ages of 1 and 2. Some states still do universal screening, but it's based on risk.
Okay. And so, how do these patients on lead present? What is the symptoms of acute lead toxicity?
So acute lead toxicity, which we rarely see anymore, this is something that was much more common when we had lead in gasoline and a lot of lead in our paint, are symptoms of seizures and tremors and acute neurological symptoms and often death. But now what we see is what we don't see. It is this kind of silent, invisible consequences, and they present later on in life with problems focusing, problems paying attention, problems in school, learning disabilities, growth issues, hearing issues. So these are the consequences of exposure. And when we do diagnose them, it's often years after the exposure, and which makes it then very difficult to do anything about it, but also very difficult to prove causation.
Are those reversible?
They're not.
Okay. So they're permanent.
Yes, lead is a permanent, irreversible neurotoxin, which is why we're never supposed to expose children to it. Not all children who are exposed will have consequences, and it depends on a lot of other risk factors, including nutrition.
That is why prevention is so
Yes,
important when it comes
prevention.
to lead, and not reactionary policies of once you see there's a lot of lead, then we're going to act after a child consumes the amount of lead for a certain period of time. In my district, the Coachella Valley Water District does not have any lead service lines, and even so they work with schools and daycare facilities to proactively test for lead in their water pipes and drinking fountains to ensure the safety of children. I want to talk about the cumulative impacts. So as a pediatrician, can you tell us what happens to a child who is exposed to lead both through contaminated drinking water and through paint in their home?
Yeah, that is a great question. The burden of lead exposure does not fall equally on our nation's children, as we've heard. It is a form of environmental injustice or environmental racism. Predominantly poor and minority children are exposed to lead, just like many other contaminants. And it's not just lead in their water. It's also lead in their deteriorating homes. It's lead in the soil because of industrial legacy uses of lead. So there's cumulative exposures that are all synergistic and additive and that impact the child. This is one.
Synergistic and additive. Do you think it is important the EPA consider these cumulative impacts when setting action levels and requirements for lead in drinking water?
Absolutely, and I think the EPA should also take the opportunity to lower the standards for all sources of lead exposure, not just water.
Okay, so I think it is clear that a drinking water standard that fails to protect low-income children or children of color is not good enough. Ms. Gaddy, do you agree?
Yes, I agree. And cumulative impacts is something that most individuals who live in certain zip codes suffer from that environmental degradation on a daily basis, and it needs to be addressed.
So today is the anniversary of the executive order on environmental justice, and the steps laid out in that executive order are as important as ever, and the example of lead exposure shows why. I have legislation that I've introduced to codify the executive order, and I appreciate that the chairman of this committee and this subcommittee included many of these provisions in the Clean Future Act. And also, it also looks at cumulative impact. So, Ms. Gaddy, do you support codifying the requirements of the Environmental Justice Executive Order?
Yes, and I'm going to be at that hearing that started at 12:30 today. I'm late, but I definitely support that.
Excellent. So I thank the witnesses for traveling to be here today, and I thank the chairman for calling this important hearing, and I look forward to working with all of you to move important environmental justice legislation forward.
The gentleman yields back, and the chair now recognizes the, okay, the gentleman from South Carolina, Mr. Representative Duncan, for 5 minutes, please.
Thank you, Mr. Chairman. I yield as much time to the gentleman from Illinois as he needs.
I thank my colleague. A couple points that we need in clarification. My colleagues from Delaware and Florida mentioned the importance of a budget, and that does set priorities, and you all answered appropriately. More money is better, less money is not. But it's instructive that, as of yesterday, my Democratic colleagues have said on the House that they're not going to submit a budget. So that would be pretty disappointing too, don't you think? If there's not even a budget submitted by the legislative branch of the House. I'm not going to draw you into the politics of this, but you can see how that's, if you're going to throw a punch, you got to be willing to take a punch. And it's not, budgets are important. They're not going to submit one, so it's difficult for me to accept the premise of attacking an executive budget that at least has presented one. Dr. Mona, appreciated the comments last time. You mentioned the unborn child. They're exponentially challenged by lead, would you say?
Yes.
And you would claim them to be a vulnerable population
Yes.
in themselves? And should they be protected?
They should be protected with strong lead and water regulations.
Thank you very much, and I appreciate that. It just, I'm glad my colleague Kathy McMorris Rogers is here because she offered a motion to recommit on the floor a couple weeks ago. We were debating another exciting issue, which was PFAS, and she wanted to enact into the law a protection for the unborn children under the PFAS standard. It was rejected on the floor, but it's important. I appreciate that testimony. Who of you here have people in your government entity that does not have water connected to any system? Oh, Ms. Bobbitt, okay. So what do they do for water?
They have water wells, private water wells at their homes.
Private water, and are they tested?
We work in partnership with the Oklahoma Water Resources Board and our health department, and they are available to be tested.
Available, but they don't have to be tested.
No, they're not mandated.
That's correct. So, but of course, all the people in your district are rich, right? We wouldn't classify them as low income.
Right, we have a median of 28,000. I don't know.
I would say you have a lot of low-income people.
Yes,
So not all low-income people live in metropolitan areas, do they?
No.
So if you have to make a decision, and I do this all the time, I have a rural area, 33 counties, driving north to south would probably take you 6 hours. A lot of parts of rural America. Would, if you got to make these tough decisions, as you highlighted earlier, right? You've got to make decisions, hospitals, EMT, all this other stuff. Is it more important for you to try to connect people on safe drinking water or rip out service lines that aren't above the lead limits? What would be, if you're going to make a decision as to what you need to do to service your constituents and you had to prioritize, is it better to rip out these lines that aren't higher in lead, or is it better to connect to these people who don't have safe drinking water?
We would work in partnership, so obviously we're not going to go in there and mandate any lines be ripped out. We're going to work in partnership. We need to come to the table together to figure out what works best to serve everybody.
Okay, here's my, let me rephrase this question. You're given a limited pot of money, and the government says, okay, this money is to rip out lines, service lines to homes that are maybe still even under 10 parts per billion. Or you could connect with the same money people who don't have connection in rural America. What would you think you would do?
We would connect.
Absolutely. And we do have programs to help do that. Rural development, I work with them closely. And for you city dwellers, we have communities that aren't connected to water. And so when we address this issue of more money to do And we want to get it safe, but we want to make sure that we can still connect everybody so that then you have at least a baseline. And that's what the rural people are going to be concerned about, is that we're going to put in more rules, more regulations, and they're not going to be able to fulfill the promise of safe drinking water to all Americans. My time's expired, and I yield back.
And the gentleman from South Carolina yields back. The chair now recognizes the gentlewoman from California, Representative Barragan, for 5 minutes, please.
Thank you. I want to thank the chair for holding this critically important hearing on the EPA lead and copper rule proposal, which I believe falls short, very short, of protecting public health from lead poisoning. And I want to thank the panelists for being here, all of you who have been working on this issue. I don't quite understand why we debate the health and safety of our children and whether it reaches a certain level and it's bad enough, now we can do something about it, when we know the medical community is saying that lead, any amount of lead, is bad for their development and bad for their health. The fight for clean and affordable water is personal. I happen to represent a district in South Los Angeles where there's only 4 districts poorer than mine. A couple of years ago, we had brown water coming out of the faucets in Compton. And I remember somebody saying, well, it's only impacting 500 people. Why do you care about this, Congresswoman? I said, one person who gets brown water is too many. And we shouldn't be putting these value sets on people and based on where they live and how many people it impacts. Everybody deserves clean water. Now, fortunately, the water did not test positive for lead. It was other issues that we had. And it just reminds me of sometimes the attitude when we should be saying that we are not going to put up with unhealthy or unsafe water for our kids and our vulnerable populations. I remember being at an event about a year ago, maybe less than that, and I had a teacher come up to me, and she was with a group of students and said, the lead in our school is testing just a tick under where action is required. And we're worried about this, and it was pretty high. And it felt so helpless to not be able to say anything on what could be done. But it's unacceptable, and we are failing and need to do something about it. And so for communities of color and low-income communities, they're certainly bearing the brunt of this. Ms. Gotti, I want to start with you and the EPA's rule required, the EPA's required environmental justice analysis of its lead and copper rule finds that household level service line replacements that depend on their ability to pay will leave low-income households with disproportionately higher health risks. Given that I represent a poor district, this is of my concern. There's also the issue of small water systems that can't afford service line replacement, which was the case in my district with my water issue. It had to be taken over by the county. It was the first time that was ever done in the history of the state. Can you please talk about this disparity and how Congress can work with water systems to ensure that small water systems and low-income households get the same full service line replacements as wealthier households?
Yes, I mean, just for example, in Newark, originally the residents were supposed to pay $1,000 towards the replacement of the lead service line, and that was a huge burden. So a lot of individuals was opting out of the program because now that is taking money away that they need to provide for their family. And then fortunately enough, our mayor and the city council was able to secure the proper funding. We all agree, especially in EJ communities, that water is a human right and that everyone deserves a right to safe, affordable, quality drinking water. And EPA should be doing more to ensure that quality drinking water is afforded to everyone throughout this country. And for those individuals who have these smaller systems, it's not an either or. If you don't have money, you shouldn't have to buy bottled water, which we know is not regulated, right, and or protected, and you should not have to pay for a lead service line. What you want is to be able to turn on that tap line, the tap water, and receive quality, safe drinking water that will help your family. And that is not happening in EJ communities and communities of low-income people. So it's definitely something that is causing a disparity, and it's a health injustice that we have to correct. And so the money needs to be found today. Action needs to be taken today to ensure that all these individuals are protected, and that that burden is not unfairly put on individuals who don't have the financial means to support the right to quality, safe drinking water.
Great. Ms. Wu, I want to, the NRDC's Threat on Taps report in 2017 talked about the enforcement and the challenges around enforcement. Can you speak to the enforcement challenges with the rule, including from how environmental justice perspective and how we can do better?
Yeah, so we found that for the most part, there's very low percentage of formal enforcements that are happening with drinking water violations in general. And we also did a report called Water Down Justice that showed that there were violations happen more in minority communities and low-income communities. So the disproportionate burden is shown by the amount of violations and how long the violations stay in violation. So enforcement is a huge part of it, and it's not happening in the communities that need it the most. And so it's an important part of making sure that the lead and copper rule, whatever it looks like, is actually properly implemented, enforced.
Great. Thank you. I yield back.
The gentlewoman yields back. The chair now recognizes the gentlewoman from the state of Washington, Representative Rogers, for 5 minutes, please.
Thank you, Mr. Chairman. I am here to yield to the gentleman from Illinois, Mr. Shimkus.
I thank my colleague for showing up and helping. So let me go with this. Ms. Gaddy, I appreciate your statement, and you mentioned, I think, and you did it just recently too, about service lines being replaced under the state of New Jersey. He's got a plan to do that, correct? And you mentioned at no cost. I wanted to just flush out. There's really no free lunch. You would agree with that, right? Someone's paying for this.
Right.
So in New Jersey, who would be paying for the replacement of these lines in this grant program you're referring to?
Well, the bill, the individuals, the homeowners, and those who, yes.
It's like, but it's a grant program, so the state of New Jersey, if I'm right, would offer money to the homeowner for the service line.
Correct.
I don't
And
know,
then-
I'm just asking, I don't know the answer to
Well, it's a variation.
Okay.
There's programs that
So
the state came in
So
to
if the state's
provide
doing it, they're getting their money how? How would the
through
state?
taxes.
Okay, thank you. So let me go to the, the Ms. Tucker Vogel, Mr. Esty Smargassi. And let's talk about the payer in these issues, right? Who's paying for water? How's it paid for?
So the
If you don't want to answer, I'll just go to the next one. So I don't have much time. You got to answer quickly.
so the ratepayers.
The ratepayers pay. So who are the ratepayers?
So the water system customers, the utility customers.
So we're either going to have the taxpayers pay and the ratepayers pay. Someone's going to pay to do this.
Correct. And then in the case of revolving loan funds, the state provides those loans, but there again, they have to be paid back. They're not grants. And so it's the ratepayers that are paying back those loans as well.
Okay, let me go to, I want to ask Ms. Licata a question. You mentioned earlier, way along about service lines going into schools and that you could not force the schools to, can you talk about that real quick?
Yeah, the EPA, neither the EPA or the DEP have the authority to force the schools to do the testing, right? So we would need Congress to grant EPA authority.
What about, do you have the force to be able to replace the school?
No, we do not.
Do you have the force to be able to force a private homeowner to do this?
No, we do not.
Do you have the force to be able to force a apartment complex to replace all their lead lines in an apartment complex?
No, we don't.
That's good, thank you. And I'm going to finish with this. A lot of this revolves, and thank you again, Dr. Mona, I'm going to use that too, because you helped identify this problem in Flint from day one. So you get all the credit for raising this issue to our attention. Ms. Dingle was right. It was a failure at all levels. I think the people who evaluated this. I want to just put this on the record so that we kind of know what really happened. And I've been on the chairman or ranking member for 9 years. My understanding of Flint is that there were horrible decisions and actions made by federal, state, and local officials. Flint happened because of money and politics. Flint wanted off Detroit water because they felt gouged on rates. The city council set an artificial political deadline that didn't meet engineering needs for water chemistry. The state cut the city slack because they were in receivership and didn't go after enforcement, and then tried to minimize it. EPA was aware of the high-level readings, but minimized their impact to avoid causing a panic. EPA also slow-walked a legal reading of the responses. That took several months. And the biggest problem was no one told the public. And that's what you lived through this experience. So we have local, state, EPA, all failed the residents of Flint. So I would, part of what you all do, even if you're a non-government organization, a public interest group, or you're a utility or with an association, we all got to stand up to protect the residents of our communities, and we can't let another level of government entity get in the way of protecting our constituents and our consumers. So I applaud you for being here, and with that, I'll yield back to the gentlelady from Washington State.
Gentlewoman yields back. The chair now recognizes the gentleman from Texas, Mr. Representative Flores, for 5 minutes, please.
Thank you, Mr. Chairman. I yield my time to Mr. Shimkus.
All right, I'm almost done. So let me go back to Mr. Estes Margiassi. Under the proposed rule, public water systems would need to access funds quickly to cover the cost of replacing its portion of a lead service line to comply with the 45-day schedule. Estimates of lead service line replacement vary, ranging from $2,500 to $5,500 per line, with some industries' estimates at $8,700 per line. What budgeting and financing challenges would public water systems operators face to replace lead service lines within 45 days? And this is really part of that intro to the last set of questions.
So the proposed rule suggests that if a homeowner replaces their portion of the line, that the water system needs to replace their portion within 45 days. Certainly financing for some utilities where this might be an unexpected expense could be an issue. More importantly, the timing itself could be an issue. For those of us who live in the north, we don't typically open up the streets anywhere between early in November and March because the folks who plow aren't really enthused about big potholes from patches in the street. So need to have sort of, one of the things we ask for as I think about rules is practicality. We need to have rules that work, they work under all circumstances, and where the enforcement makes sense. I wouldn't want a water system to be in violation of the rule because they couldn't do something practical, even though that was their intent. We'd want to see coordination between the homeowner and the city.
So, we are debating a proposed rule that's been proposed by the administration in October of last year, and the deadline is tomorrow, don't forget. And it's better to be debating a proposed rule versus not talking about any rule that hasn't come down the pike in 20 years. So let me follow up with you. Same question, same panelist. Do you anticipate that the 45-day requirement would lead to a change in the frequency or types of customer requests for lead service line replacement?
What I think we're seeing from the rule will be that with inventories and letters that more people will be interested in this, and there will be a demand in some cases for the homeowner to replace their piece of the line when the city's not currently ready. It's not necessarily efficient. Systems will need to figure out how to make this work if that's the rule, because we want to satisfy our customers' demand. If a customer wants to remove the lead service line, we're going to have to figure out how to manage that. But we'd like to be able to create a system where if we're doing lead service lines in a neighborhood, we get all of them done, and we do it efficiently and with as least disruption to the streets and so on.
If the homeowner ultimately fails to replace their portion as intended, what might be the consequences for the homeowner and or the public water operator?
So this has been the crux of the issue around lead service line replacement. Even if, and in fact I can offer concrete examples, even where a water system's prepared to pay for 100% of the lead service line replacement, all the way from the main to the person's home, we don't get 100% participation. We have homeowners who aren't interested in having the city come and dig up their front yard or go down in their basement for whatever reason and pull that lead service line out. So we're seeing, even in communities in my area, where our funding enables the communities to put together a program that covers the whole cost, that they're getting around 90%. They're not getting that last 10%. Some homeowners just aren't interested. And we don't have the authority to be able to make them remove that last piece of pipe.
Yeah, and let me ask with this, and I only have a minute left. So no one here at the panel is proposing forcing government trench diggers to pull out lead pipes on private property, are they? Does anyone say we want to authorize the federal government to protect the individual who lives in this home, that we are going to mobilize and eminent domain personal property to remove their lead pipe? Is anyone proposing that? Ms. Wu? No. I thank you very much, and I yield back my time.
The gentleman yields back. Several documents have been requested to be entered into the record of this proceeding. Let me just list what we have that's been approved. A letter from the United States Conference of Mayors and the National League of Cities, a letter from National Rural Water Association, a letter from American Public Water Works Association to EPA, a letter from American Public Works Association to the Energy and Commerce Committee, a press release issued earlier today by EPA with acknowledgement of some inaccuracies. And finally, I'd like to thank all of our witnesses for providing not only tremendous information, but I think establishing for us priorities. You know, that's what budgets are. They're priorities. We can either do relief for those most wealthy and bloat our deficit, or we can prioritize our children and their health. I remind members that pursuant to committee rules, they have 10 business days to submit additional questions for the record to be answered by our witnesses. I would ask that each witness respond promptly to any such questions that you may receive. I believe a few of you didn't get to respond to Representative Soto, so if you could do that also. And at this time, the subcommittee is adjourned.